touted as a means of significantly reducing the number of persons who were presenting themselves at testing sites to obtain COVID-19 clearance certificates. Health Minister Dr. Frank Anthony announced last week that the Ministry of Health will cease issuing such documents. The COVID-19 clearance document is accepted by many companies from employees who would have tested positive for the disease and completed their isolation period before resuming work. In addition, employees were using it as evidence to submit to the National Insurance Scheme in order to claim their sick benefits. On the sidelines of an event on Monday, Dr. Anthony was asked by this newscast, what proof can people now use to claim their sickness benefits from the National Insurance Scheme?
If persons require an NIS, they're required to claim for the days that they're staying home, then those are things that they'll have to work out with NIS. And I'm sure if they take to NIS the test results from one of the reputable labs to show that they have tested positive and that they were isolating for the 7th day, then I don't think NIS would have a problem with them with accepting their COVID-19 tests.
Nightly News understands that some public testing sites across the country do not issue any document outlining a person's positive COVID-19 status. However, Dr. Anthony said that they should be issuing such papers. The minister further stated that persons who test positive for COVID-19 should isolate for up to 7 days from the onset of the symptoms.
And that time period really from the time you've tested positive, that you wait for 7 days, and if the last 2 days that you're symptom-free, then you don't need to do another test. You can, after the 7th day, go back to work.
With more than 13,000 active cases in the country and in excess of 12,000 persons in home isolation, Dr. Anthony said that monitoring these patients has become a challenge for the ministry. As such, regional health authorities have been advised to create innovative ways of checking in with patients under their purview.
Each region has their own responsibility for monitoring the persons within their region. So they have been checking in on those persons. In Region 4, we continue to monitor, and we have the HEOC. They have staff set aside that would normally call to make sure that to get the status of the person.
Meanwhile, the daily case tally has significantly dropped in the last 24 hours. 173 new infections were recorded, increasing the active caseload to 13,644. 153 people are hospitalized and 20 in the COVID-19 intensive care unit. Temika Rodney reporting for the HGB Nightly News.